Can you guess what all of these people have in common? Yes, they've all suffered from one or the other type of mental disorder at some or the other point in their lives. The same mental disorders which do not discriminate based on age, gender, ethnicity, socioeconomic status, or political inclinations. The lack of understanding and stigma in the society regarding mental disorders is unfortunate and astonishing. Hence, this small attempt on our part to help you make you understand mental disorders a little bit better in the hope that some of your stories have a better ending. In my personal experience also, I have come across a lot of derogatory terms which are used when it comes to describing people with mental disorders. Say, for example, a lunatic or a whack job, crazy, weirdo, or even something as simple as lazy or unmotivated. But when it comes to a cancer survivor, the words used are strong, courageous, and bold. So where does this difference lie? One thing that we have found is probably because of the lack of objective evidence when it comes to mental disorders. The thing is that there are no specific blood investigation that says this is where the problem lies, or any particular CT scan or MRI which says this is where the lesion lies. And the unfortunate belief among the public is that if you cannot see it, it must not be true. What people fail to understand is that mental illnesses are as real as your physical ones. They are caused by a dysregulation in the neurotransmitters in your brain. I understand that there are a lot of questions that are left unanswered when it comes to psychiatry and mental disorders. And one of the main reasons for it continues to be stigma. I'll give you one more example. When it comes to even my own colleagues, other departments, I have seen, for example, in the emergency room, say you're brought a patient who's sustained a road traffic accident and another who's attempted suicide through hanging or poisoning. I have seen people say to first choose the accident because that was accident, and the other one, which was suicide, is self-inflicted and the person chose to do it. That's what they say. What I want to say is nobody chooses to be mentally ill. Nobody chooses to be depressed or, have a panic attack. The same way nobody chooses to have a fracture. In spite of all this, the stigma continues to loom large. And because of this, it's become like a vicious cycle. One more example I would like to quote is last year apparently, the number of deaths that happened due to breast cancer were 40 million. And when it came to suicide, it was 44 million. In spite of that, in the NIH, the budget allocated for breast cancer research was a whopping 650 million. But when it came to suicide and mental health, it was a mere 50 million. So where does the discrepancy lie? That's why this year's theme for the World Mental Health Day is a call for greater investments leading to greater access in the hope that we could find more targeted and specific cures for mental disorders. 1 in 4 people experience mental illness in their lives. Look around you. Somebody you know might be going through it right now and trying their best to hide it from you. When I said the statistics, 1 in 4, I'm sure a lot of you thought, that's not me, that could never be me. But let me remind you something. Mental disorders can affect anybody. Being a psychiatrist, I myself am not immune to it. It could happen to me, it could happen to you, or your loved ones. So please do not stigmatize mental disorders, which in turn does nothing but to ostracize them and traumatize them further. Even if you are the most well-educated and liberal person in this world, it is only natural for humans to be a little bit judgmental. But when that judgmental behavior crosses a certain threshold, it turns to prejudice and stigma. So that is where we need to stop ourselves. So the next time you come across a person who's mentally ill, instead of being derogatory to him or trying to be judgmental, just listen to them. And if you or your loved ones are facing through some struggles and are having difficulty adjusting to them, and you feel that you are not feeling all right, do not hesitate to reach out to a mental health professional. Remember, talking about your feelings does not make us weak, it makes us human. Thank you.